cells. So, what are stem cells? Well, just to take that a step further, they're essentially, once we mature beyond that developmental stage, they're your body's internal repair system. And so what they can do is a stem cell can make more stem cells by replication, or it can make ligaments, tendons, blood, cartilage, muscle, bone, nerves, organs, again, or more stem cells. So it's amazing what they do. They're anti-inflammatory, they're immunomodulatory, they seek out degeneration, and then they build and repair and grow new tissue. So I always like to give a brief explanation. In your body, let's say you have a bad knee or two, and we inject stem cells into your knee. The areas that have the most inflammation in your knee, wherever that, whatever component of that structure it might be, the inflammation actually draws in the stem cells, and then based on the type of tissue that's damaged in that area, that's what the damaged tissue gives off actually chemical signals to the stem cells that tell them what they need to turn into, whether they need to make cartilage or whether they need to make meniscus, or exactly what it is that they need to repair in that area. So it's kind of cool. The inflammation brings them in, and then based on the cellular damage in that area, the body tells the stem cells what type of repair to undergo.